Income, housing, location, and changes over time. What roles do these factors play in mental health service and support use in Ontario? A public-led applied health research question.
We are the ICES Public Advisory Council, or PAC. The ICES Public Advisory Council is made up of people across Ontario. We reflect on the perspectives and values of Ontarians and shape how ICES uses data to improve healthcare in Ontario.
In 2021, the PAC, with the ministry-funded Applied Health Research Question team, worked together to better understand the following questions using ICES data. Where did Ontarians seek mental health services, and what were their reasons for visiting? Did mental health service use change over time? And does mental health service use differ depending on income or where people live? And this is what they found. In this project, PAC members and scientists explored many of the mental health challenges that Ontarians face. For example, anxiety and depression, schizophrenia, paranoia, alcoholism, drug dependence, trouble sleeping, and eating disorders. For our project, we looked at whether people visited an emergency department or family doctor to seek help for these mental health challenges. It is important to remember that there are many other factors that can influence mental health service use, including how severe the mental health challenge is and what service is closest to someone. Next, PAC members and scientists looked at different factors or measures. The data does not always provide the full picture of what is happening, but it can leave clues on where to look. These clues are also known as measures. The relationship between each measure on mental health and addiction service use was explored on its own, including housing situation, neighborhood income, and geography. They also looked at different time points, specifically before the onset of the COVID-19 pandemic in 2020, and the rest of their measures focused on the period following. At the beginning of the pandemic, Ontarians more frequently visited a doctor for help with mental health issues, most often by phone or computer. This increase is most likely due to primary care doctors, in other words, family doctors or clinic doctors, switching to virtual care and becoming more available for mental health concerns, specifically mood and anxiety disorders, compared to other services like physical exam that must be done in person. This increase went back to pre-pandemic levels once restrictions had been lifted and physicians went back to in-person or hybrid models of care. During the early months of the pandemic, Ontarians made fewer visits to the emergency department for mental health reasons, likely due in part to public health restrictions on in-person visits and the ability to have a virtual visit with primary care doctors for mental health concerns. Things also varied depending on other factors, including housing situation. We looked more closely at these factors, specifically during the rest of the pandemic period of winter 2022, to get a better idea of what things look like now. Household and dwelling situation was one of those measures, and it looks at people living in neighborhoods where there are a high number of homes that are not owned or persons living in apartment or rentals. It also considers the number of persons that have moved in the last 5 years and the number of persons living in one dwelling or home. The data suggests that people living in neighborhoods with more unstable housing made greater use of mental health services, specifically for mood and anxiety disorders, than those living in neighborhoods with less unstable housing. The data also suggested that people living in neighborhoods with the highest levels of unstable housing had about 2 times more visits to their doctor, and almost 3 times more visits to the emergency department for mental health-related issues than people living in neighborhoods with the lowest levels of unstable housing. The PAC had their own observations on housing situation and mental health services.
Unfortunately, the results show that in some parts of the province, lower income and unstable housing may impact the choices we have about where to get help in the healthcare system.
Next, the PAC members and scientists looked at neighborhood income levels to see how this impacted mental health service use. The data suggested that mental health use for people living in neighborhoods with the lowest income was similar to what they saw for people experiencing unstable housing. The data suggests that people living in neighborhoods with the lowest income levels made nearly 3 times more visits to the emergency department for any mental health concern than people living in neighborhoods with the highest level of income. The PAC had their own observations on neighborhood income and mental health services.
Unfortunately, the results show that many of us who are low income may be less likely to have a doctor who we can visit easily, especially during a crisis.
Finally, the PAC members and scientists looked at the use of mental health services across the regions of Ontario. They found that things look different depending on where you live and where you're seeking services for mental health. The data suggests that people living in northern parts of Ontario, regardless of their age or sex, are more likely to use emergency services when experiencing mental health issues compared to those living in areas like Toronto, particularly when visiting for mood and anxiety disorders and substance use. But doctors' visits for mood and anxiety-related disorders are lower in northern areas than in other areas of the province. On the other hand, Toronto has higher rates of physician visits for any mental health concerns in Ontario. The data suggests that this was driven largely by mood and anxiety disorders. The PAC had their own observations on experiences based on geography and mental health services.
The data from the north is not surprising. Doctor shortages in the region may influence the number of doctor visits shown in the results. Additionally, these results are for the entire Northwest region, but the Northwest region is huge. It is important to remember that general results may not necessarily reflect the details of what individual communities are experiencing.
PAC members highlighted their hope for this work.
We hope that this research supports public awareness about mental health, addiction healthcare use, and potential challenges Ontarians could face when accessing care. Continuing work by groups advocating for improved access to comprehensive mental health care and further opportunities for public participation in administrative data research and analyses.
Finally, it is important to remember that we studied the relationship between each individual measure of housing, income, and geography, and mental health and addiction service use on its own. While these results are valid, the next important step is to study the collective effects of these measures, and possibly others, when considered simultaneously. This will provide a clearer picture of how these and other factors interact.